want to begin the change or become a statistic due to coronavirus? Your impact can begin with following social distancing policy and educating yourself. The coronavirus is affecting us all and can be very deadly if we do not educate ourselves. I have done extensive research on the social distancing policy and the spread of the coronavirus. Today I'll explain to you how dangerous the coronavirus really is, how social distancing can flatten the curve, and how we can follow through with social distancing and other practices to do our part in flattening the curve and limiting the spread of the coronavirus. So let's start with how dangerous the coronavirus is. The coronavirus is a dangerous virus that can spread exponentially. This virus is expected to be 3 times more infectious than the flu. So this means if one person gets the virus and passes it to 3 people, and those 3 people pass it to 3 more people, and this continues for 10 cycles, there will be 59 infections of the coronavirus, according to the Business Insider published on March 23, 2020. The main contribution to high infectious rates is that someone can be infected with the virus and have no symptoms. Also, patients can be asymptomatic for up to 2 weeks and can be contagious during this time, according to clevelandclinic.org, published on April 4, 2020. Although this is an extremely contagious virus, there are many ways to limit the spread of the coronavirus while out in public if social distancing cannot be maintained. According to USA Today, published on April 5, 2020, the CDC recommends people wear masks in the public where social distancing cannot be maintained. According to WebMD, published on April 22, 2020, the coronavirus can live on a variety of surfaces for up to a few hours to several days. So it's also beneficial to properly use gloves in public places to keep yourself safe from the virus. So ultimately, what is the best way to prevent the spread of the coronavirus? This would be social distancing. So what is social distancing and how can it help prevent the spread and flatten the curve of the coronavirus? According to New Scientist published on March 17, 2020, social distancing practices are changes in behavior that can help stop the spread of infections. Among these often include limiting social contact, work, and schooling among seemingly healthy individuals, with a view to delay transmission and reduce the size of the outbreak, according to cdc.gov, published on April 4, 2020. Social distancing is also called physical distancing. This means space between yourself and other people outside your home. To practice social or physical distancing, you should stay at least 6 feet away from other people and do not gather in large groups, and stay out of crowded places and avoid mass gatherings. How does social distancing apply on a large scale? According to Johns Hopkins Hospital, published on March 13, 2020, the concept has little modern precedence at a large scale. He also points out to an early study, not yet peer-reviewed, showing the different experiences and peak coronavirus rates in 2 Chinese cities. In the city of Guangzhou, which implemented disease control measures early into the outbreak, they had significantly lower rates of hospitalizations due to COVID-19 on its peak day compared to the city of Wuhan, which put measures into place a month into the outbreak. One of the main benefits of social distancing, if put into action early enough during an outbreak, is the effect it has on the epidemic curve, its ability to flatten it. How can you follow through with social distancing and other practices to do your part in flattening the curve of the coronavirus pandemic? Many cities have already implemented a large scale of social distancing, but we should all be making an effort to practice social distancing in our personal lives and encouraging others to do the same. The number one way to perform social distancing is to avoid close contact. COVID-19 spreads primarily through person-to-person contact via respiratory droplets from when a sick person coughs or sneezes. You should also not greet people with a handshake or hug. In fact, keep about 6 feet space between yourself and others as often as possible. And also avoid large crowds, staying away from gatherings and crowds of more than 10 people, especially if space is limited and limited air circulation. According to Houston Methodist Leading Medicine, we know social distancing works because of a 2007 study that analyzed how several U.S. cities managed during the 1918 Spanish flu influenza epidemic. The study found that the cities that implemented preventative social distancing measures, like closing schools, churches, and theaters, in the early stages of the outbreak, experienced less disease transmission as well as less deaths. Whether it's postponing a wedding, canceling conference, or complete lack of live sports and entertainment, the aftermath of a large-scale social distancing has likely already affected your everyday life. Flattening the curve reduces the number of cases occurring at any time. This helps ensure that hospitals have supplies and resources needed to provide those with severe illnesses affected, and they will receive the care they will need. Although the coronavirus is a huge threat to everyone, this virus is very preventable when following the appropriate measures correctly. Today I summarize to you how dangerous the coronavirus really is, how social distancing can flatten the curve, and how we can follow through with social distancing and other practices to do our part in flattening the curve of the coronavirus pandemic. Coronavirus can be a very deadly virus, but with the help of everyone and doing their part with social distancing, we can flatten the curve.